Hernias represent a prevalent medical condition wherein internal organs or tissues protrude through weakened areas or openings in the abdominal wall. This presentation aims to offer a comprehensive exploration of hernia management and treatment, encompassing various hernia types, their associated risk factors, symptoms, and available interventions. By appreciating both surgical and non-surgical approaches, we aim to equip healthcare professionals with the knowledge needed to effectively address this common medical concern. 1. Inguinal hernia. Description: the most prevalent type, where abdominal contents protrude through a weakness or defect in the abdominal wall in the groin area. Classification: can be categorized as indirect or direct based on the specific pathway the hernia takes. 2. Femoral hernia. Description: occurs when abdominal contents protrude through the femoral canal, situated just below the inguinal ligament. Prevalence: more commonly observed in elderly women due to anatomical differences in the pelvic region. In understanding the risk factors for hernias, several key elements come into play. Firstly, individuals with a family history of hernias are more susceptible to developing the condition. This heightened risk is often attributed to genetic or congenital factors that predispose them to abdominal wall weaknesses. Another significant contributor to hernia risk is smoking. Smoking has been shown to induce collagen defects and weaken the abdominal wall, making individuals more prone to hernia formation. Moreover, activities or conditions that lead to increased abdominal pressure can also heighten the risk of hernias. For instance, obesity and pregnancy are known to exert substantial pressure on the abdominal wall, potentially causing weaknesses and facilitating hernia development. Additionally, chronic conditions such as chronic obstructive pulmonary disease, COPD, can elevate hernia risk. The frequent coughing and straining associated with COPD can strain the abdominal muscles, increasing the likelihood of herniation. Understanding these risk factors is crucial for both prevention and early detection of hernias, enabling individuals to take proactive measures to minimize their risk and seek timely medical attention if needed. When it comes to hernias, recognizing the symptoms and securing an accurate diagnosis are paramount. Typically, hernias manifest with pain, discomfort, and a noticeable bulge, particularly noticeable during physical exertion or coughing spells. These symptoms can vary in intensity depending on the size and location of the hernia. In more severe scenarios, a hernia can progress to become incarcerated or strangulated. In an incarcerated hernia, the protruding tissue becomes trapped and cannot be pushed back into the abdominal cavity. This can lead to persistent pain and potentially dangerous complications. Strangulated hernias are even more serious, as they involve a restriction in blood flow to the herniated tissue, resulting in tissue damage and potentially life-threatening consequences. For diagnosing hernias, ultrasound imaging is often the preferred modality. Ultrasound provides detailed insights into the presence of a hernia, its specific type, and its precise location within the body. This imaging technique is non-invasive and highly effective in confirming the diagnosis, enabling healthcare providers to formulate an appropriate treatment plan promptly. Let's dive into the subtypes of inguinal hernias. First up, we have indirect inguinal hernias. These hernias take a path that parallels the spermatic cord, making their way into the scrotum through both the deep and superficial inguinal rings. They tend to be more common and can often be felt as a bulge in the scrotum or groin area. On the other hand, direct inguinal hernias take a more straightforward route. Instead of traveling into the scrotum, they penetrate the abdominal wall directly, bypassing the scrotum and only entering the superficial inguinal ring. While less common than indirect hernias, direct inguinal hernias still present a risk and require proper evaluation and management. Understanding the nuances between these subtypes is crucial for accurate diagnosis and effective treatment planning for patients with inguinal hernias. Moving on to femoral hernias. These occur when abdominal contents protrude through the femoral canal, which sits just below the inguinal ligament. Unlike inguinal hernias, femoral hernias are more prevalent in elderly women. This higher occurrence is attributed to the wider pelvic anatomy in women, creating a larger femoral canal, which increases the risk of herniation. Understanding the anatomy surrounding hernias is crucial. One essential landmark is Hesselbach's triangle, formed by the inguinal ligament, inferior epigastric artery, and rectus abdominis. This triangle serves as a guide for understanding the location of different hernia types, aiding in accurate diagnosis and treatment planning. Now let's discuss incisional hernias. These hernias develop at the site of a previous abdominal surgery, like an appendectomy or cholecystectomy. They arise due to weakness or defects in the abdominal wall resulting from the surgical incision. Several risk factors increase the likelihood of developing incisional hernias. Among them are conditions that impair wound healing, such as smoking, immunocompromised status, and ongoing infections. Additionally, excessive pressure on the abdomen, premature resumption of activities, or pregnancy during the healing process can also contribute to the formation of incisional hernias. Now, let's explore hernia treatment options. For hernias with a high degree of abdominal wall integrity, conservative management may be suitable. This approach involves watchful waiting and activity modification to alleviate symptoms and prevent complications. However, for incarcerated or strangulated hernias, as well as most other hernia types, surgical intervention is often necessary. Surgical correction can be achieved through two main methods: herniorrhaphy, which involves suture repair, or hernioplasty, which utilizes mesh repair techniques for added strength and durability.